What would you like to die from if you had a choice? That's a bit of a question, isn't it? Well, the key challenges for end-of-life care, and we mentioned these with respect to research and also in clinical work, is actually not only just to care for people with cancer, but to care for people with all illnesses. Second key challenge is not just to wait for terminal care traditionally at the end of life in hospices, but to start at diagnosis of a life-threatening illness. And our research certainly shows that at diagnosis of an illness is when someone can be very stressed psychologically and existentially. Third challenge is actually to care for all dimensions of need: physical, psychological, social and existential. Fourth one is to care not only in hospices, but in hospitals, where most people are still currently dying, in care homes and in general practice. And the fifth biggest challenge, if you want, is caring for people in our global community overseas. We did a study to compare people dying in Scotland and in Kenya, where I used to work. So we asked people here in Scotland, said, what's your main problem? And this was a group of people who had advanced lung cancer and would probably die in the next 6 months. We asked them, what's your main problem? And the main problem here, in fact, was not pain control, because pain control is accessible. It's just me. It was often this existential area and anxiety and social problems, I remember one chap said, I want to get married. It was relational, okay? The same question we asked in Kenya. We said, what's your main problem? Thina yako ni kurunene, the local language. And do you know what it was there? It wasn't social, it was, I have no money for pain control. It was pain. So there was a physical dimension was the one that was the main there. The other three aspects, though, which are social and psychological and existential, were relatively well catered for, okay? People would come round and visit. They'd maybe bring some eggs or some maize meal to support the person. They would come round and chat to them. The local church would come and they would sing together. So there's support in all the dimensions apart from pain. Whereas in Scotland, in comparison, the pain is dealt with, but the other dimensions, people are anxious. Folk might not visit. He's got cancer, I don't know what we'll say, so people don't visit. So these three other dimensions, the psychological and the social and existential, more distress. So we could compare that. And we can learn from Africa about these other dimensions, but we possibly have a mandate to go and help and try to get morphine available in Africa. Because just now, you see, there's only 4 or 5 countries of 52 in Africa where there's a good service where people can get morphine at the end of life. In most countries, it's not available at all. So people are dying in pain. There's been a big push in the last 30 years in Africa for vaccinations. The big push we must now have is to have end-of-life care, morphine delivered. So a nurse catering for these 3,000 or 4,000 people in rural Africa should be able to do the end-of-life care bit. That would be my vision. We have a chance of teaching medical students here at Edinburgh, and it's a difficult subject, but I think they realise that they need to know something about this because they understand that patients often do die. So they're very interested to find out what's going on, and we just try to explain that whatever special, even if they're going to be a dermatologist, we sometimes tease, you may still have patients who die. So you need to know about how to help someone at the end of life. So we're introducing in the curriculum, for instance, in cardiology, not only how to diagnose a heart attack, how to manage someone with a heart problem, but also how to help someone die well, with a heart condition. So we're trying to integrate end-of-life care in all the specialties. Very stimulating area for students because some of them haven't thought about death and dying themselves, so it has to be done quite carefully.
This production is copyright the University of Edinburgh.